Hello and welcome to Health Matters on Channels Television. Thank you for joining us. I am Mary Alale Yusuf. Cancer is a leading cause of morbidity and mortality globally, accounting for 8.8 million deaths in 2015. That's according to the World Health Organization. Some common cancer sites are the lungs, liver, colon and rectum, the stomach and the breasts. Colorectal cancer ranking third as the most common cause of cancer death, according to the WHO document updated in 2018, involves the colon or rectum, both end parts of the large intestines. My guests on the show are founder of Neola Cancer Care Foundation, Eniola Akintunde, and a consultant gastroenterologist surgeon at the Lagos University Teaching Hospital, Idiraba, as well as co-founder, Neola Cancer Care Foundation, Dr. Adedapo Oshinawo. You're welcome to the show.
You're welcome.
Thank you.
Thank you.
My biggest problem with cancer is the misdiagnosis. When people say, you know, they tested and they just kept thinking it was something else. Who do you examine for colorectal cancer? What are the symptoms like?
The symptoms of colorectal cancer, the major symptoms of colorectal cancer are one, abdominal pain, blood in stool, or what we consider a significant change in bowel habit. Right. I need to emphasize something. Colorectal cancer can also be symptomless, especially
symptomless.
Yep. Especially in its early stages.
Okay.
Right. But I need to clarify certain things you mentioned earlier. Colorectal cancer is the third commonest worldwide, but in Nigeria,
yes, it's a bit different, right?
It's a bit different in Nigeria, right? There's been an increase in incidence in Nigeria as compared to what obtains in the 60s or in the 40s. The incidence has been increasing gradually over time, right?
Could it be because of more awareness? Not really as a result of more sicknesses?
I'm very sure it's multifactorial. It could be increased awareness, increased adoption of Western diet. Okay. That's actually a factor. But what is a little bit worrisome is we're seeing colorectal cancer in people in their 40s. That's the 5th decade of life. That's more worrisome. The average age of colorectal cancer patients is about 41, 45. That's quite worrisome as compared to what you used to obtain. You still say it in people in their 60s and 70s. But when you say colorectal cancer in people, when the mean age of colorectal cancer is somebody in this 40s, that's a bit worrisome. Like you mentioned, the symptoms, the major symptoms are abdominal pain, a significant change in bowel habit or blood in stool. Let me talk about the abdominal pain. Vast majority of people have abdominal pain. We all have abdominal pain at once.
And so they could just think it's something else.
No, it's not. See, the abdominal pain of colorectal cancer is slightly different. It's going to be a persistent abdominal pain. Okay. You're going to have it on and off for a long time. It's not something you're going to have for 1 week and it goes away forever. You're going to have it, the individual is going to have it for a long time. But the problem we have in Nigeria is, one, the health-seeking behavior of most Nigerians is quite poor. You have abdominal pain. Your friend has abdominal pain. And your friend tells you, oh, I took antacid, I took this drug. And you know in Nigeria, you can regularly buy...
You just take it and
take care
of your stuff.
You know in Nigeria, you can buy virtually anything over the counter.
That's true. Right?
It buys the drug over the counter and perchance he responds to it. He or she is going to assume, oh,
problem is taken care of.
If the problem is taken care of, if the abdominal pain recurs, it does the same thing again.
That's why I'm interested in the blood in the fecal matter. That seems like a less widespread kind of symptom for a sickness.
It's not as wide, it's quite widespread. Quite enough people pass blood in stool, right? What is worrisome about that is you pass blood in stool and you must construe it as pile. No, that's what the average Nigerian tells you. Oh, I pass blood in stool, right? You pass blood in stool. The truth about it is, if 10 people pass blood in stool, usually maybe 1 out of 10 that will end up having cancer. Okay. But that is not to say you should trivialize your passing blood in stool.
I'll come back to you, Doctor. I know that you're heading somewhere really fast. But let me ask Eniola here. You have been touched very closely and personally with colorectal cancer. Tell me how that was and what were the symptoms you saw?
Yes, well, I'm also a survivor because for someone that takes care of a cancer patient and you see it from the beginning to the end, so you are also a survivor. So I'm a survivor, and then it was my late husband, and some of the things doctor just mentioned now were the things we saw in him.
Well, how did you feel when you saw those symptoms? What were your thoughts?
Well, it's still the same.
Did you think about cancer?
No, we were not even treating cancer. We were treating typhoid. It was being treated for typhoid and stomach pain. Okay.
Was that from a hospital or by yourself?
No, from the hospital.
Okay.
It's because most diseases will present themselves with fever, with malaria, and you understand? Pains and all that. So, and when they were treating him, obviously when my husband, when it was diagnosed and they later got that it was colorectal cancer, it was far gone. It was far gone. These symptoms that doctor just mentioned, my late husband was having same symptoms. But we trivialized it, we didn't take it serious. As of 2009, 2007, 2008, he was complaining of abdominal pain. He was having gas, painful, then even stooling was a problem.
So obviously, the symptoms are not the foolproof way to go when it comes to diagnosing colorectal cancer.
You know, it goes a long way. They assist you a long way. They assist you in a long way.